Wait 1 minute to read the question. Right, so if you have read and understood, considering it history-taking station, kindly please begin.
Hello, I'm Dr. Faizan. I'm one of the surgical candidates. May I confirm your name, please?
Yes,
Yes,
doctor.
I'm Dr. John. Okay, can who is helping? Me or
You
someone else?
carry on, please.
Okay, continue,
Okay.
please.
I'm Mr. John. I'm 28 years old.
Nice meeting you, Mr. Jones. Can I please know what has brought you to the hospital today?
Actually, I have a knee pain in my left knee for last 3 months, and actually I'm suffering for almost a year. And a few years back, I had an injury in my left knee, and since
Okay.
then, I'm suffering.
Okay. Mr. Jones, how did the pain start? Was it after your injury, or was it before it?
Actually, I didn't have any pain before the injury. It started after the injury, and I had an operation also to recover from it, but the problem didn't solve.
Okay. Can you please describe me the type of pain you have, whether it is a sharp or it is a dull type of pain, or can you describe it?
It's actually a dull aching pain, and it is almost constant, and it's more when I play or I have any kind of exertion, it worsens.
Okay. Does it go, the pain go anywhere else, or is it confined to your knee, Mr. Jones?
No, it's almost confined to the knee.
Okay. Can you please rate your pain from a scale of 1 to 10? How much would you rate your pain?
Now it's almost 8 out of 10.
Oh, I'm so sorry to hear that. We'll take care of your pain. Um, can you, did you have any history of any giving away of your knee, or locking of your knee while walking?
Yes, sometimes I feel like giving away when I work uh, uh, without being that much cautious, and
Okay.
sometimes it's also locking.
Okay. Do you have any fever or swelling of your knee?
No, there is no that kind of swelling. And fever, no, I didn't have. I didn't remember of any kind of fever associated with that.
Okay. Do you have any stiffness of your knee joint?
No, no, that kind of stiffness.
Okay. Do you have any back pain?
Uh, no, no significant back pain is there.
Do you have any rash over your body, or any redness in your eyes?
No, doctor.
Okay. Okay, Mr. Jones, do you have any other medical problems?
No, actually, I don't have any kind of medical problem.
Are you on any medications?
I use painkiller for this knee pain on several occasions for last kind of 1 year.
Okay. What medication and what dosage do you use?
I use paracetamol often,
Okay.
500 milligram.
Okay. What do you do for a living, Mr. Jones?
I am a footballer,
Okay.
and I don't do anything else.
And do you stay alone at home, or do you have anyone with you at your home?
I have my spouse at my home.
Okay. Are you able to mobilize easily at your home? Do you have any problem in climbing stairs or walking around at your home?
No, at home I can manage myself.
Okay. Do you have the habit of smoking or alcohol consumption?
No, that I don't have. I'm not a smoker.
Okay. Yeah. Okay. That concludes my history taking. Thank you. Do you have what do you think is your problem, Mr. Jones? What is the idea about your problem? What is your idea about your problem?
Actually, I think there's an injury, a severe kind of injury that's not solved yet, and that's disturbing my daily activities. And I want to
Okay.
solve that for with any kind of permanent solution.
Okay. What do you expect from us, Mr. Jones?
Expect if I need any kind of surgery, I expect that it will be solved permanently, the knee pain.
Okay, can you please summarize your history taking?
Okay, ma'am. A 28-year-old footballer who had a history of injury to the knee few years ago, which was operated, now presented with pain in his left knee since 3 months. The pain is more on doing activities and
Yes.
less on rest and taking medications. There
Yes.
is no history. There is a history of giving away of the knee and also a history of locking of the knee. There is no history of fever. There is no history of swelling of the joint, knee joint. There is no history of stiffness. There is no history of back pain. There is no history of any rashes or redness of the eyes. And the past medical history is patient does not have any other comorbidities. There is history of surgery of the left knee 3 years ago.
All right. So what are your provisional and differential diagnosis for this patient?
My provisional diagnosis are a patient could be having meniscal injury or ligament injury of the knee, or patient could be having osteoarthritis of the knee.
All right. How would you confirm your diagnosis?
Firstly, I would like to take a detailed history with the clinical examination of the patient, and
Yes.
I would go for an radiograph of the knee joint,
Yes.
anterior-posterior and lateral view, and if needed, I would go for MRI of the knee joint to assess the ligaments of the knee joint.
What advice would you give to the patient? How should the patient be managed?
The management could be conservative initially with
Yes.
strengthening of the muscles around the knee joint with physiotherapy and regular exercise. And if also, I would ask the patient to decrease weight if he or she is obese. Then,
Okay.
if it fails, then I would go for intraarticular steroids.
Okay.
And based on MRI findings, if the patient has a ligament injury, then patient might need arthroscopic repair.
Yes.
And if the patient has osteoarthritic findings, then the patient might need after physiotherapy, if the patient doesn't improve, then patient might need a surgical intervention in the form of either realignment osteotomies or a partial or total knee replacement.
Right. Okay. Would the patient be able to play football again? in a 9 months time period? Yes? No, answer is no. Okay, thanks.